Wellness Center, and in this video I'm talking about the 5 things that you might have not known about vitamin D. See, vitamin D is something that we're all familiar with. We all know that we require vitamin D to help with a lot of different processes in the body. A lot of the things that people know about is vitamin D is required for bone health, or at least certain things. Now, if you watch my last video, you know that vitamin D also helps improve your moods, or people with anxiety, depression, that kind of deal. So there's other things that vitamin D works really well on. These are things that you might have never heard of, or maybe you're not familiar with in such a way. So I just wanted to give you a little bit of heads up. Again, coming into this winter months, we lack vitamin D. Well, not even just in the winter months. Before that, our population is always very deficient in vitamin D. What happens is, it's called a sunshine vitamin. This is where when you're exposed to sunlight, your body actually makes vitamin D on its own using the ultraviolet rays. But we also do sometimes have to supplement. You have to eat good sources of vitamin D are things like your fatty fishes, your salmon, mackerel, things that have a little more fat to them, because vitamin D is also what we call a fat soluble vitamin, which means when you're taking vitamin D, you need to be taking it with something that's a little fatty, because it helps absorb it better. So that's one of the big things. So now let me tell you a few things that you might not be familiar with about what vitamin D can do in the body. So the first one is it actually helps your immune system. There's been studies that have shown that in the winter months, if you actually take about 4,000 IUs of vitamin D, it helps protect you from a lot of the respiratory tract disorders, your pneumonias, your common colds, sinus problems, things like those. Vitamin D helps boost your immune system. It kind of keeps your immune system working a little bit better. So that's one of the other reasons why anybody with an autoimmune condition definitely benefits from vitamin D. And a lot of times people that have any autoimmune conditions are actually very deficient in vitamin D. So taking a little bit of vitamin D helps boost your immune system. Number two that you might not be familiar with is vitamin D is actually an ACE inhibitor, which means it actually helps lower your blood pressure. So I'm not saying you're going to take your blood pressure pills and throw them down and just do vitamin D, but vitamin D has been shown to act on the same things that blood pressure medications work on. And now that, because of that blood pressure things, it actually is also very cardioprotective, which means it helps your heart. So cardiovascular health and helps hypertension. Number 3 is it helps protect against a lot of the hormone-mediated cancers, which mean your breast cancer, cervical cancer, prostate cancer, any of these hormone-mediated cancers. Vitamin D levels have been shown, or if you're low in vitamin D, you are more at risk for it. But when you have higher levels of vitamin D, it actually is very protective against these things. So there was just some research out there that they say that if your vitamin D levels are anywhere between 40 to 60, well, the exact number was 52. If your vitamin D levels, especially for women, if your vitamin D levels are at 52, you have a 50% less chance of developing breast cancer. And that's pretty significant. Just having your numbers at 52 gives you a 50% less chance of developing breast cancer. Now that same thing goes for prostate cancer. There's been a lot of research on that as well. So it is very helpful for people with prostate cancers, as I said, testicular cancer, cervical cancers, any of those cancers, vitamin D levels help with that. So we'll take some of those. Now, number 4 is weight problems. We know in the winter months, everybody's, put on a little bit of those extra pounds. That's because when you're low in vitamin D, it actually does not suppress certain hormones. Vitamin D is a pro-hormone, so it acts with and acts like a hormone. So when you're deficient in vitamin D, some of the hormones that kind of help suppress your appetite or help the fat storage are not working as well as they should. So you start storing more fat. But again, in the winter months, there's also the thing where your body primarily, kind of wants to store some more fat to give you an added layer to protect you from the cold weather. So again, being deficient in vitamin D or having low levels of vitamin D are things that can make you gain weight or maybe not lose the weight that you're trying to lose. So again, adding vitamin D for that. The 5th point here is muscle aches and pains. So chronic muscle aches and pains. If you have chronic tight muscles, if you're one of those people that say that I just cannot relax, my muscles are always very tight. I have a lot of those kind of patients. That is what we call a calcium utilization problem. This is where your body is not utilizing the calcium the right way. And what happens with that is your muscles stay in more of a contracted position. So vitamin D, we all know, helps your body absorb calcium or helps your bones absorb calcium better. So that's one of the reasons why if you're deficient in that, you can end up with a lot of muscle tightness. This is where, I've had a lot of patients who come and say, my muscles are always tight and I always feel very stiff and achy. What's going on? Vitamin D deficiency. Now, every nerve cell in our bodies, all the nerves that we have, actually have vitamin D receptors on them. So what happens is when you're deficient in that, the nerve cells or the cells or the nerves are not working as well, and you become more sensitive to pain. So nerves actually sense pain, right? So when you're deficient in vitamin D, you sense more of this pain and you end up with a lot of that muscle aches and pains kind of feel. So take some vitamin D. Now again, so I've given you 5 of these. So the other question turns out is, what vitamin D should I take? How much should I take? Well, again, now vitamin D3, that is the most active form, cholecalciferol, is vitamin D3, which is the active form of vitamin D. That is the one that we actually suggest patients take pills off. Now again, new research has shown that taking vitamin D with vitamin K2. Now vitamin K is another fat-soluble vitamin which is required by the body, because what it does is when you take calcium in, not just for the bones, what happens is vitamin D takes it to the bones, yes, but again, vitamin D does not only take it to the bones. It can actually deposit it into your muscles. It can deposit it into your arteries, things like that. So vitamin K directs the calcium where to go. With vitamin D, and when you take vitamin K2, it actually directs the calcium where to go. So vitamin K2 will actually help protect you from getting any artery calcifications, from muscle calcifications. Sometimes people end up with calcium-built kidney stones, things like those. You will prevent yourself from getting those. So if you're taking a vitamin D supplement, make sure it has vitamin D3 with K2 in it. Now, how much should you take? So anywhere from about 1,000 to 4,000 international units of vitamin D is what we suggest just as a maintenance dose. If you're deficient, of course, we can help kind of get you up there by going up anywhere from 10 to 20,000 IUs for a few weeks, but it has to be monitored. So what we suggest is about 1 to 4,000 IUs every day will help as a maintenance dose for vitamin D. Now again, taking about 4,000 IUs, as I mentioned, is actually very protective for your immune system. Will help prevent you from ending up with the colds and flus for this season. So try some of these. Now again, if you have any questions or comments, please post them below. And if you enjoyed this video or you found this information useful, please share this information. There's a lot of people that are not taking vitamin D and suffer with so many different conditions. Well, we talked about depression and anxiety in the last video, but all these other 5 things that I mentioned are things that people don't know about. So share this video, and if you like it, I'll see you in the next one. Thank you.